We've also just talked about what a huge effort it is. So at what point is buckling back down on restrictions the answer if this contact tracing isn't enough?
Yeah, so we've said this all along, and the contact tracing is enough. We've seen, as you know, over the last few weeks, a gradual increase in numbers of people who have tested positive, and we've been reporting out on the contacts as well, and we're now up around 1,700 people who have been in contact and that we're following up on a daily basis. So we have the resources to do that. We've presented some data as well earlier on that looked at the numbers of contacts per case, and it had started quite high and then it went quite low, and now it's creeping up again, and that is concerning. Right now we are holding our own. We're able to contact 98% of the people who are close contacts of our cases here in BC. We're not seeing a lot of unlinked cases, and yes, this is the work that the teams are doing across the province. It's it's hard work. A lot of us are working long hours doing this, and I think the kudos go out to the teams across the province. So this is a welcome surge capacity, and will also allow some of the other important work that has been put aside necessarily to focus on the pandemic to be picked up again. But I really think it's a testament to the teams that we have here in public health in BC that we've been able to manage this, and we will continue to manage this.
Tanya, do you have a follow-up?
The Premier, yes, please, for the Premier, and just a warning to Minister Dix, I would ask for a response in French as well. Despite the urging of public health officials, we are still seeing a surge in cases among young people, and I know this has been the theme all summer. We've asked you this before, but even after additional restrictions were put in place on venues like bars, beyond a scolding, I guess, from you as Premier, what is the next tactic to get those cases more under control, especially with schools opening?
Well, thank you for the question. And Dr. Henry and Minister Dix and I have been talking about that very thing over the past number of days. Obviously, this is a welcome infusion of healthcare professionals on the contact tracing side, so that can relieve the pressure, as Dr. Henry said, on the extraordinary work that's been done to this point in time. But as we've seen over the past number of weeks, the good behavior, the common sense of British Columbians is not consistent across the board. Although the vast majority of British Columbians are listening carefully to public health directives, they're acting appropriately. There are incidences where that's not the case. If it's a commercial establishment, of course, we've taken actions through public health, through other enforcement measures. But when it comes to things like private parties, people flaunting the restriction on the number of faces in the smaller spaces. And so we're going to be looking hard at enforcement when it comes to situations like that. We don't want to do that. We prefer the good judgment of British Columbians, but those tools are available to us, and they're escalating, starting with warnings, of course, and then getting into more severe penalties. But we have been successful without taking a punitive approach to this pandemic, and we want to keep it that way. But if people continue to work around or try and disregard the rules that the rest of British Columbians are following, then we will, of course, take action.